Welcome to the Question of the Week series with Pass the OT. Let's test your knowledge and strengthen your NBCOT exam skills. This week's question comes from Upper Extremities. An OTR is evaluating a client who presents with a recent onset of upper extremity pain, numbness, and weakness. The client was recently evaluated by a neurologist, and a nerve conduction study revealed involvement of the distal median nerve. Which hand movement would the OTR expect to be most affected by this diagnosis? A. Opposition of the thumb. B. Wrist extension. C. Wrist pronation. D. Elbow extension. Take the next 10 seconds to think through your answer, or pause the video if you need more time. The correct answer here is A. Opposition of the thumb. The median nerve arises from the nerve roots of C6 and travels medially down the humerus, where it passes through the cubital fossa at the elbow, and then distally through the carpal tunnel at the wrist. The motor function of the median nerve is to primarily innervate the wrist flexors and thenar muscles. The most common pathology of the median nerve is carpal tunnel syndrome, which produces sensory and motor impairments of the palmar surface of the hand. When the thenar muscles are affected, this results in impaired opposition of the thumb. Why are other options incorrect? B. Wrist extension. The muscles responsible for wrist extension are primarily innervated by the radial nerve and would not be affected by median nerve entrapment or compression. C. Wrist pronation. Wrist pronation would not be affected as it is proximal to the distal median nerve. D. Elbow extension. The muscles responsible for elbow extension are innervated by the radial nerve and would therefore be unaffected. Thanks for watching, and be sure to join us for another question of the week from Pass the OT.